Did you know nowadays eye doctors can use VR to test and screen for glaucoma? In fact, in our office, we have a couple of different VR devices that test for different eye conditions. And because one of my earliest videos was about VR, Blur, the Quest 2, I thought it'd only be fitting for this channel to go over how VR has now been incorporated into certain parts of the eye exam. So let's first talk about glaucoma and how VR might help diagnose somebody with glaucoma. Now, if you've seen any of my previous videos, glaucoma is the silent thief of sight, meaning there are people walking around that have no idea they have glaucoma. They really can't observe the symptoms that glaucoma causes. So it's really important to go in for your eye exams. Now, there's a few things the eye doctor is going to look for. One is the good old classic eye pressure test with either the fun air puff test or some other ways to measure your eye pressure. Now, if you have high eye pressure, it doesn't automatically mean you have glaucoma, but high eye pressure is linked with glaucoma. They'll also look at your optic nerve in the back of your eye and see if it has any suspicious damage that might be from glaucoma. So if there's any of these suspicious signs for glaucoma, your doctor might perform additional tests, and that's where this comes in. One classic test that you might have is a visual field test. Now this tests your peripheral visual field to see how far out your peripheral vision is, and if you have any maybe micro or small blind spots in your vision that you don't really notice on a day-to-day basis. So this big old hunk of a machine is called the Humphrey Visual Field, and it's been around for ages, but it's considered a staple in pretty much all of eye doctors' offices that are treating and managing glaucoma or even screening for it. In fact, this is still considered the golden standard for testing visual field vision. Now, like I said, in glaucoma, you can develop these little blind spots in your peripheral vision. And the way to test for that is to show little specks of light in different areas of your vision, and when you see that, you push the button saying, hey, I saw that. Now, this usually runs a patient through a threshold test, shows a light at a certain brightness, goes around your vision, comes back, shows the same spot with a little bit dimmer light, and you keep pushing the button until you can't see it anymore, because it's testing to see if you have any low response in certain areas. Maybe there's a blind spot that's starting to develop. And this is one of the biggest reasons why this is so important. Even if you have this little area that maybe looks suspicious, you usually repeat it a few times, maybe within that first year, and see if it's getting bigger and worse, and if it's repeatable. If so, then there's a chance that you have glaucoma. Now, as you can imagine, there are some limitations to this big hunk of a machine. First off, the patient has to be able to rest their chin and forehead up against there pretty much the whole time. If they get tired and drift back, it won't be accurate. If they drift off to the side, or if they start to fall asleep and their eyes close, it's not going to be accurate. Also, we have to patch one eye at a time because we have to test one eye at a time. Now, we need to have their prescription in there a lot of times, and they can't really wear their glasses because a lot of times it will slide down or they'll get in the way of testing in this big bowl for their vision. And so we have to put trial lenses in this guy with their prescription and line it up just right to their eye for it to be accurate. So yeah, it can be a pretty annoying test to set up right, but also very important. Now this does pretty much the same thing as that big hunk of a machine, but it's really nice because you can just leave patients in the exam chair. You can bring this to them. It is really important that you get this centered just like the other machine because you are testing peripheral vision. So if it's off center, then the test might not be as accurate. But what's really nice is even if the patient tends to drift back or forward or to the left or to the right, this still has it lined up and follows their movement. And so there's a lot less questionable results that way. This also can walk them through all the steps and the instructions. They can hear it really well, and they have the clicker, so it's kind of have this tactile feeling. And patients really do respond quite well to this. At first we were kind of nervous, especially maybe the older population and VR don't really mix very well, but they've done really well. In fact, we find that this may be a lot easier for them than trying to hunch over and get in that big machine and understand what's going on. This also can do it in different languages, so if we have a Spanish patient, this can do all the instructions in Spanish, so it can be really helpful. Now, as far as accuracy is concerned, this can be really accurate for mild, moderate glaucoma. When you're getting into the more serious stages of glaucoma where you're really measuring down to what blind areas they have in glaucoma, then usually it's been better using the big hunk of a machine, the legit machine. Yeah, so we still keep both around so we can accurately track and test for those. They're also able to wear their glasses, their prescription, while doing this test, whereas that machine, we have to insert those lenses, those trial lenses, to get their prescription. So that makes it way more convenient for the patient and for us doing the test on them. Now, one thing, if you know me, I'm really stickler about the VR lenses. This has the good old Fresnel lenses that were in the Quest 2. They have the rings and the Quest 3S. And so it does kind of give off a little distortion, and you have to be really lined up to find that sweet spot. And so that part just kind of has me like, ugh. So I'm really kind of a stickler making sure that it's lined up just right. And it really has just kind of 3 different pupillary distance settings. And so there's just some limitations there where I always kind of, kind of cringe there, but we're still getting really good results with this. But anytime I question it, I usually have them do the big machine. But overall, way more convenient, it's faster, patients understand it better. It seems like we're getting just as good of results, maybe even better, just because this is easier for them to understand and work. And so I'm liking it. So you might see your eye doctors using more and more of this if you ever get screened for that. One thing I almost didn't mention is that this will automatically patch one patient's eye. It will just shut that side off. The patient doesn't need to wear a patch or anything, so the machine just does it for us. Speaking of doing the job for us, I recently just did a video about this company that is pretty much fixing a lot of the issues we have in VR. Eye strain, blur, and at the same time, they're developing a type of device that allows you to get your own glasses prescription just by looking at the device and going over through the test. This is something that eye doctors won't even need to use this guy anymore. It's really interesting. If you want to check out that video, check it out right here. If you have any questions, leave them in the comments. Stay focused.